good morning to all of you. I'm Dr. Pradeep Pawar, Professor of Anatomy, teaching anatomy for the undergraduates and postgraduates, the postgraduate entrances as well, all over India and abroad. A vast experience I have in teaching anatomy. Okay, we'll just wait for 1 minute till the others join in. We'll start. Okay. Identify this pointed structure. Some images in the form of MCQs and some MCQs also that we'll be discussing today. Identify this pointed structure. Good morning to all of you. Whatever you know, you answer. Yes, identify this pointed structure. This is a very important slide, very important visual slide. This is the lateral sulcus of the brain. I'll start. That's the lateral sulcus of the brain here. And which is this vein that we are getting in the lateral sulcus. This vein is lying superficial in the lateral sulcus. This is what we call as the superficial middle cerebral vein. Superficial middle cerebral vein, right? So this is what we call as the superficial middle cerebral vein. So now we'll just discuss about the veins draining the brain. Veins draining the brain. Right. So now when we classify the veins of the brain, this is a difficult topic and this is a very, very important topic for you. So just try to understand. So when we classify the veins draining the brain, venous drainage of the brain, we classify them into superficial veins and deep veins. Superficial and deep veins. Just 1 moment. Superficial veins and deep veins. So we are classifying the veins draining the brain into a superficial and a deep veins. Superficial veins. Can anyone answer this? The first one. The superficial veins are 1. Superior cerebral veins. Superior cerebral veins. So superior cerebral veins will be present on which surface? They would be present on the lateral surface of the brain, right? That's the supralateral surface. So the superior cerebral veins would drain this lateral surface of the brain. They would drain the supralateral surface of the brain, and this superior cerebral veins would open into this sinus here, which is the sinus on the upper border of the falx cerebri, students. This would, what is that sinus in the upper border of the falx cerebri? Bolona, you can answer this. Yes, what is that sinus located in the upper border of the falx cerebri? That's the superior sagittal sinus. Superior sagittal sinus. So the superior cerebral veins will drain the lateral surface of the brain and they will open into the superior sagittal sinus. Clear? They will open into the superior sagittal sinus. That's the first vein. Second, inferior cerebral vein. अब ये inferior cerebral veins क्या करेंगे? They will drain the inferior surface of the brain. They will drain the inferior surface of the brain. They would open into the cavernous sinus and the sigmoid sinus. You can write that. I'm not writing. You can write it. So inferior cerebral vein drains the inferior surface of the brain. They open into the cavernous and the sigmoid sinus. They open into the cavernous and the sigmoid sinus. Third one is the anterior cerebral vein. Now this anterior cerebral vein, where does it lie? It lies in the medial surface of the brain, in the callosal sulcus. In the callosal sulcus, it lies on the medial surface of the brain. It drains the medial surface of the brain. Okay, I'm just telling you the superficial veins. So the superior cerebral veins, the inferior cerebral veins, the anterior cerebral vein, they drain the medial surface. And fourth is the middle cerebral vein. Middle cerebral vein. Middle cerebral vein is of two types. One is the superficial middle cerebral. And the other one is the deep middle cerebral. Okay, superficial middle cerebral and the deep middle cerebral. So the superficial middle cerebral vein drains what? It drains medially, it communicates with the cavernous sinus, and laterally it communicates with the superior sagittal and the transverse sinus. The superficial middle cerebral vein. Medially it communicates with the cavernous sinus, and laterally it communicates with the superior sagittal and the transverse sinus. And the deep middle cerebral vein lies deep in the lateral sulcus. Okay, so these are the superficial veins of the brain. Clear, students? Superficial veins of the brain. Look here once again. One is the superior cerebral, second is the inferior cerebral, lies at the inferior surface. Third is the anterior cerebral vein, lies on the medial surface, and the middle cerebral vein. So the superior cerebral veins drains the lateral surface of the brain, open into the superior sagittal sinus. Inferior cerebral drains the inferior surface of the brain, opens into cavernous and the sigmoid sinus. Anterior cerebral vein drains the medial surface of the brain, opens, that I'll tell you, and the middle cerebral vein is divided into a superficial middle cerebral and a deep middle cerebral. Superficial middle cerebral lies superficial in the lateral sulcus, opens, communicates medially with the cavernous sinus and laterally with the superior sagittal and the transverse sinus, and the deep middle cerebral vein lies deep in the lateral sulcus. Now understand this. Anterior cerebral vein, this is a very important MCQ. Anterior cerebral vein plus the deep middle cerebral vein plus the stride veins. So anterior cerebral vein, the deep middle cerebral vein and the stride vein together joins to form the basal vein. Together joins to form the basal vein. So how is the basal vein formed? The basal vein is formed by the joining of anterior cerebral vein, the deep middle cerebral vein and the stride vein. Together joins to form the basal vein, and this basal vein opens into the great cerebral vein of Galen. The basal vein will open into the great cerebral vein of Galen. Clear? So that's about the superficial veins of the brain. So you have to know what is basal vein. ये basal vein कैसे बनता है? So basal vein is formed by the joining of three veins. One is the anterior cerebral, the second one is the deep middle cerebral vein, and the third one is the stride veins, जो perforated substance से आते. They come from the perforated substance, together joins to form the basal vein, and the basal vein now opens into the great cerebral vein of Galen. So this is about the superficial veins of the brain. Now just one deep vein we have. I'll come to this once again. Only one deep vein we have. Right, and which is the deep vein? The deep vein is deep vein, and this is another very important thing. Deep vein is the internal cerebral vein. Internal cerebral vein. And this internal cerebral vein is formed at the foramen of Monro. Okay, it is formed at the foramen of Monro by joining of one thalamostride vein, second septal vein, and third is choroidal vein. So thalamostriate, what does this mean? It lies between the thalamus and the caudate nucleus. The thalamostriate vein jyoti, it lies between the thalamus and the caudate nucleus. So that vein which drains the thalamus and the caudate nucleus is known as the thalamostriate vein. The second vein is going to drain the septum pellucidum. Septum pellucidum, and this vein is what we call as the septal vein. Septal vein. And the third vein is going to drain the choroid plexus. So this becomes the choroid vein. Now together they join to form the internal cerebral veins. Two internal cerebral veins joins to form the great cerebral vein of Galen, and this great cerebral vein of Galen drains into the straight sinus. The great cerebral vein of Galen drains into the straight sinus. Is this clear to all of you? So this is a very, very important MCQ. How is the internal cerebral vein formed, students? Internal cerebral vein is formed by the joining of three veins, the thalamostriate, the choroidal and the septal vein. Two internal cerebral joins to form the great cerebral vein of Galen, and that drains into straight sinus. And what opens into the great cerebral vein of Galen is the basal vein. Basal vein. Okay, so that's about the venous drainage of the brain. I've just told you in short. Okay, fine. Now coming to the next MCQ, just have a look at this. Answer this. This is another extremely important MCQ. Students, try to understand this. Be there and answer. Come on. Anyone? A 50 years old man is brought to the emergency department complaining of severe chest pain. His angiogram reveals thrombosis of SVC after the entry of azygous vein. This condition would mostly likely to cause dilatation of which of the following veins? Yes, can you answer this? Which is the vein dilated? Okay, to understand this, I'll explain this MCQ. Just have a look, understand this. Right. I'll start. Now, what is this vein coming from the neck? Students, what is this vein coming from the neck? This is the internal jugular vein. Internal jugular. What are these veins coming from the upper limb? From the upper limb. These are the subclavian veins. The internal jugular vein coming from the neck. The subclavian veins coming from the upper limb. Joins to form. What is this vein going to be? One coming from the cephalic region, one coming from the brachium. So this is what we call as the brachiocephalic vein. That's the right brachiocephalic, that's the left brachiocephalic vein. The left joins with the right like this and now forms what? SVC. It now forms the SVC. Okay? So these are the two internal jugular, these are the two subclavian veins. That's the right brachiocephalic, that's the left brachiocephalic, that is the SVC. And what is this vein? This is a single unpaired vein. What is this? This is the azygous vein. Azygous vein. So single unpaired vein, it is known as azygous vein. Fine. Now, what is this vein? Which ये azygous vein पीछे होता है, it's behind. And this azygous vein comes and opens into the SVC. The azygous vein is going to arch over the hilum of the right lung. It arches over the hilum of the right lung and opens into the SVC. Opens into the SVC. Okay. Now, what is this vein? This vein is on the anterior aspect. ये आगे होता है. And this vein opens into brachiocephalic vein. It opens into the brachiocephalic vein. This is right in front. ये आगे होता है. Any guesses? What is this vein? This is the internal thoracic vein. And this internal thoracic vein will give two branches, or it will be formed by two veins. One is the superior epigastric vein, and this is the musculophrenic vein. Superior epigastric and musculophrenic. So ये आगे है. Now this is the internal thoracic vein. I'll just label this for you. That's the internal thoracic vein. So internal thoracic vein is on the anterior aspect. Azygous vein is on the posterior aspect. And what opens into this internal thoracic vein? I've just made one vein for you. This is the anterior intercostal vein. ये होगा anterior intercostal vein which opens into internal thoracic vein. And what communicates what anastomosis with this anterior intercostal vein is posterior intercostal vein. And this posterior intercostal vein on the right side opens into the azygous vein. Opens into azygous. This is a very important and difficult MCQ, so try to understand the students. Look here, once again I'm telling you. The vein which is present behind the sternum, what is that? Internal thoracic vein. And what are the veins which open into the internal thoracic vein? ये आगे होंगे. These are the anterior intercostal veins. Azygous vein पीछे होता है, it's behind. And what are the veins which open into the azygous vein? The right posterior intercostal veins. So I've just shown an anastomosis here between the anterior and the posterior intercostal vein. They're anastomosed with each other, right? So I'll label this as the anterior intercostal vein, and I'll label this as the posterior intercostal vein. Anterior intercostal vein, posterior intercostal vein. Okay, I'll start now. Now, understand this. There is an obstruction to the SVC above the opening of azygous vein. यहाँ पे obstruction है. There's an obstruction to the SVC above the opening of azygous vein. The obstruction is here. How will the blood flow now? Students, understand this first. I'll write this later. Don't write anything. There's an obstruction to the SVC above the opening of azygous. The blood cannot go down. Obstruction here, so the blood cannot go down. What does the blood do now? The blood goes in a reverse direction. It goes in a reverse way. The blood enters into this vein. What is this vein? Internal thoracic vein. The blood enters into internal thoracic vein, then anterior intercostal vein, then posterior intercostal vein, then azygous, SVC, and the right atrium. So how does the blood flow? If there's an obstruction here, the blood goes up into the brachiocephalic, it goes into the internal thoracic vein, anterior intercostal, posterior intercostal, azygous, SVC, and right atrium. That's one way of blood flow. There's one more way of blood flow, students. There's one more way. The blood goes from the internal thoracic vein. The blood goes straight down. What's this now? This is the superior epigastric vein. And if you can tell me, this superior epigastric vein is going to anastomose with what? The superior epigastric vein is going to anastomose with the inferior epigastric vein. This inferior epigastric vein opens into external iliac vein. External joins with internal to form common iliacs. Dono common iliacs joins to form the IVC and the right atrium. So this is how the blood flows when there's an obstruction to the SVC above the opening of azygous vein. I'll just write this for you. Have a look. Understand this first. So this is obstruction to the SVC. I'll explain now. मैं explain करता हूँ. पहले आप लिख लो ये. This is very important. Obstruction to SVC above the azygous vein. Obstruction to SVC above the opening of azygous vein. So I'll start. Internal thoracic vein. And internal thoracic vein से दो pathways है. One is anterior intercostal vein, posterior intercostal vein, azygous, SVC, right atrium. Okay, anterior intercostal, posterior intercostal, azygous, SVC, and right atrium. From the internal thoracic vein, superior epigastric vein, inferior epigastric, external iliac, common iliac, IVC at the right atrium. So this is how the blood flows. This is very important, students. So this is obstruction to the SVC about the opening of azygous vein. Understand this? Once again I'll explain. Obstruction यहाँ पे है. So but before that, look, once again identifying the veins. These are the two veins coming from the neck. ये होंगे internal jugular. These are the two veins coming from the upper limb. These are the subclavian veins. Internal jugular and subclavian joints to form the right brachiocephalic. ये होगा left brachiocephalic vein. The left brachiocephalic vein is longer. Joins with the right forms the SVC. And what opens into the SVC is the azygous vein. The azygous vein opens into the SVC. This one is the azygous vein which opens into the SVC. What is this vein in front? This is the internal thoracic vein, right? That's the internal thoracic vein. And this internal thoracic vein divides into, is formed by two veins. One is the superior epigastric and the second one is the musculophrenic vein. Now students, there's an obstruction to the SVC. Look. There's an obstruction to the SVC about the opening of azygous vein. How does the blood flow? The blood cannot come down, so the blood accumulates here. The blood enters into the internal thoracic vein, then anterior intercostal, posterior intercostal, azygous, SVC and right atrium. Oh, there's one more way. From the internal thoracic vein, the blood goes straight down. What's that? The superior epigastric, then the inferior epigastric, external iliac, common iliac, IVC and the right atrium. Is this clear to all of you? This is one obstruction. अब ये दूसरा obstruction देखिए. Now see the second obstruction. The second obstruction, I'll just jot this down for you. Now, understand the second obstruction. The second obstruction is below the opening of azygous vein. यहाँ पे obstruction है now. The obstruction is here now, below the opening of azygous. I'll clear the obstruction above. This I'll clear this. So now the second obstruction is below the opening of azygous vein. Now tell me students, how's the blood going to flow? Look here. The obstruction is here, below the opening of azygous vein. The blood cannot go down. So students, the blood accumulates here. Again, suppose if the blood enters into the internal thoracic vein, the blood enters into the anterior intercostal, posterior intercostal, azygous, SVC. अब ये नहीं चलेगा. This is not going to work because obstruction is below the opening of azygous. समझ में आ रहा है? So the first pathway जो लिखा था हमने, the first pathway that we had written, I've erased it. ये मैंने निकाल दिया. Understanding? So the blood, suppose if it enters into the internal thoracic vein, suppose it goes in the anterior intercostal, posterior intercostal, azygous, SVC, that will not work. That's the first obstruction. That's the first pathway which is not going to work. The second pathway, this one, internal thoracic vein, here, the superior epigastric, inferior epigastric, external iliac, common iliac, IVC, right atrium. This will work. ये work करेगा. This is going to work. Now, this one more pathway. This is what I want you to understand. This one more pathway. एक और pathway है. Try to understand this. Tell me students, the blood goes up. What is this now? Brachiocephalic. From the brachiocephalic, the blood goes out. What is this now? That's a subclavian vein. If that's a subclavian, tell me students, what is this that I've drawn? What is this vein that what is this that I've drawn? That's the first rib. If that's the first rib, what is this vein? अब जैसे subclavian crosses the first rib, what is that vein known as? Axillary vein. Axillary. Now this axillary vein is divided into three parts by a muscle. What is this muscle here? This is the lateral, this is the pectoralis minor. Pectoralis minor. So which is this part of the axillary vein, students? This is the second part of the axillary vein. And in this second part of the axillary vein, we got a vein here. Name, this is the lateral thoracic vein. That's a lateral thoracic vein, and this lateral thoracic vein of the upper limb, students, would directly communicate with the vein of lower limb. What is that vein of lower limb known as? The superficial epigastric vein. Superficial epigastric vein. You understand? So look here once again, the blood goes up, the blood enters into the brachiocephalic, the blood goes outwards into the subclavian, into the axillary. That's the second part of the axillary vein. There's a tributary there, that's the lateral thoracic vein. From the lateral thoracic vein, the blood directly goes to a vein of the lower limb. Uska naam hai superficial epigastric vein. The superficial epigastric vein drains into great saphenous. The great saphenous drains into femoral, then external iliac, common iliac, IVC, right atrium. That's how the blood goes from the lower limb into the right atrium. This is extremely important. So now tell me, students, you become a surgeon in future, right? You become a surgeon in future and a person comes to you, you diagnose it as obstruction to the SVC below the opening of azygous vein. As a surgeon, you would look on the lateral aspect of the chest wall, right? You would be looking on the lateral aspect of the chest wall for a dilated and tortuous vein. And this vein, this will be the dilated and tortuous vein, and this vein is going to connect two veins. A vein of the upper limb with a vein of the lower limb. Which vein of the upper limb is that? The lateral thoracic vein. With which vein of the lower limb is that? The superficial epigastric vein. Superficial epigastric. And if you join this, you get the name of this vein. This is the thoracoepigastric vein. Thoracoepigastric. Okay, I'll write this down for you. Obstruction to SVC below the opening of azygous. So obstruction to the SVC below the opening of azygous. So we make two arrows right here. I'm starting with this. Brachiocephalic vein, subclavian vein, axillary vein, lateral thoracic, thoracoepigastric, superficial epigastric, great saphenous, femoral, external iliac, common iliac, IVC and right atrium. ठीक है, देख लो एक बार. This is a difficult topic to understand, so I've drawn both obstructions. Above and below, above and below the opening of azygous vein. So obstruction to the SVC above and below the opening of azygous vein. तो दोनों मैंने लिखा है. When you are reading one, you remove the other obstruction. When you are reading the other, you remove the other first obstruction. Is this clear, students? Yes, bolo. Is this clear to all of you? This is a very important topic. Obstruction to the SVC. Obstruction to the SVC. One is below the opening of azygous vein and one is above the opening of azygous vein. Clear है सबको? Look here, once again, I'll quickly go through it. So these are the two, look students, once again, quickly I'll go through it. These are the internal jugular vein, this is the subclavian vein, that is the right brachiocephalic, that's the left brachiocephalic, ये होगा SVC, ये होगा azygous vein, and this is the internal thoracic vein. This is the musculophrenic vein, that's a superior epigastric vein. This is the anterior intercostal vein which opens into the internal thoracic vein, that's the posterior intercostal vein. On the right side it opens into the azygous vein. Now there's an obstruction to the SVC. About the opening of azygous vein. Here, this was the first obstruction. So, ये निकाल दो फिर आप, हाँ? You remove this obstruction. So the blood goes into the internal thoracic, then anterior intercostal, posterior intercostal, azygous, SVC, and right atrium. The second pathway, internal thoracic vein, superior epigastric, inferior epigastric, inferior drains into external iliac, common iliac, IVC, right atrium. That's one. Now, suppose if the obstruction is above the opening of azygous vein, the main pathway is this brachiocephalic, subclavian, axillary, lateral thoracic, then the thoracoepigastric vein, then the superficial epigastric, the great saphenous, femoral, external, common, and IVC. Okay, so that's about the obstruction. Now, very important MCQ. Chalo, we'll start. We'll go to the next MCQ now. So what is the answer for this? A 50 years old man is brought to the emergency department complaining of severe chest pain. His angiogram reveals thrombosis of SVC after the entry of azygous vein. After the entry of azygous vein, that will be below the opening of azygous vein. After the entry of azygous vein. Yes, so that is below. So this condition would most likely lead to dilatation of which of the following veins? So your answer would be the thoracoepigastric vein. Thoracoepigastric. Clear? C. Very good. Okay, very good, very good. Nirupam, very good. Chalo, you answered this MCQ now. What is this pointed structure? Come on students, answer this MCQ. What is this pointed structure? Anyone? Bolo, bolo, bolo. These are the tendons going to the fingers. What is this? This is the hand. Ye hand hai na? You have identified this structure as the hand, which is this aspect of the hand, the palmar aspect of the hand, and these are the tendons which are going to the hand. Which will this tendons be? Ek hoga flexor digitorum superficialis, and the other one which is lying deep to the superficialis is going to be the flexor digitorum profundus. Flexor digitorum profundus. So flexor digitorum superficialis and the flexor digitorum profundus. Okay, now tell me, which is the pointed structure? The pointed one. कौन होगा ये? Yes, the pointed structure is the tendon of flexor digitorum. This would be the flexor digitorum superficialis. Flexor digitorum superficialis, and here होगा flexor digitorum profundus. That would be the flexor digitorum profundus. Yes. So how do you know this? Come on, we'll just go to it. Very good, very good. Very good, Nirupam, you're answering well. Okay, just quickly answer this. Proximal, middle and distal phalanx, proximal and distal phalanx. Okay, understand this now. So the tendon of flexor digitorum superficialis. Now flexor digitorum superficialis के 4 tendons होते हैं. There are 4 tendons of the superficialis like this. These are the 4 tendons of flexor digitorum superficialis. Each tendon divides into 2 slips like this, and it is inserted on the base of the middle phalanx, right? It is inserted on the base of middle phalanx. So each tendon will divide into 2 slips, and it is inserted on either sides of the base of middle phalanx. So this is the tendon of flexor digitorum superficialis. Flexor digitorum superficialis. And what is this tendon of? ये किसका tendon है? This tendon is lying deep to the superficialis. It is deep to the superficialis. इसके नीचे होता है. And this tendon goes and gets inserted into the base of the distal phalanx. Base of the distal phalanx. This is the flexor digitorum profundus, and this is the flexor digitorum superficialis. Clear? Clear, students? So the tendon of flexor digitorum superficialis divides into 4 tendons. Each tendon splits into 2 slips, which is inserted on the base of the middle phalanx. So if you can tell me, this flexor digitorum superficialis is going to act on all the joints that it has crossed. जितने भी joints cross किए. One, what is the origin? Medial epicondyle. So it will cause flexion at the elbow joint. Second, it will cause flexion at the wrist joint. Third, it will cause flexion at the metacarpophalangeal joints. And the flexor digitorum superficialis is going to cause flexion at proximal interphalangeal joints. Proximal interphalangeal joints. The flexor digitorum superficialis is not going to act on distal interphalangeal joints. It will not act on the distal interphalangeal joints. Clear? Whereas the flexor digitorum profundus is inserted on the base of the distal phalanx, and this is going to flex the distal interphalangeal joints. It will flex the distal interphalangeal joints. What is the nerve supply of flexor digitorum superficialis? बोल सकते हो? Nerve supply. Students, nerve supply of flexor digitorum superficialis. Come on. Nerve supply of flexor digitorum superficialis is the medial nerve. And flexor digitorum profundus has got two half. One is the medial half and the lateral half. Yes, the medial half of profundus is supplied by which nerve? Ulnar nerve. And the lateral half of profundus is supplied by a branch of medial nerve. What is that? Anterior introitious nerve. Anterior introitious nerve, that's a deep branch of medial nerve. That's a deep branch of medial nerve. Clear? And students, if you can quickly tell me, there are small worm-like muscles which arise from the tendons of flexor digitorum profundus. What's that? What are those small worm-like muscles which arise from the tendons of flexor digitorum profundus? These are the lumbricals. Okay, so these are the lovely little muscles which arise from the tendons of profundus. Okay, that's good. So clear to all of you? Is this clear? So this slide is clear? Right. So this is superficialis and that is profundus. Coming to this, if you can identify this pointed structure. Identify the pointed structure. This is a very important visual as well as an MCQ, a very important MCQ. Anyone, can you answer this pointed structure? Bolo. Bolo bachcho. What is this? Any guesses? Pointed structure ये है ना, ये probe है ना, that's the pointed one. That's a pointed structure. No one? Loop है ना, loop. It's a loop. What is a loop known as? Anyone? What is a loop known as? And the loop is found in the neck, cervix. Come on, I'm giving you a hint. A loop found in the neck. Neck is the cervix. A loop is known as what? Ansa. Abhi bolo. Ansa cervicalis. Very good. ये जो loop देख रहे हो आप, this loop is nothing but the ansa cervicalis. This you have to know. Very good, Nirupam. This is the ansa cervicalis, and this ansa cervicalis lies on the anterior wall of carotid sheath. Remember this. The ansa cervicalis lies on the anterior wall of carotid sheath. And how is this ansa cervicalis formed? How is this ansa formed? A very important MCQ. I'll just quickly go through this. How is this ansa cervicalis formed? Tell me now. Ansa is a loop, है ना? ये loop है. And to form this loop like this, you need 2 nerves. You need 2 nerves to form a loop like this. Like, you know, there was a loop here. This was a loop of an artery. We call this as the arches, the superficial and deep palmar arches. And to form a loop of an artery, you need two arteries. Two arteries will come and join to form the loop. Okay, that is the arch, right? So you've got the superficial and deep palmar arches. Similarly, there's a loop here. And how is this loop formed? By two nerves. Okay, I'll start, just have a look. This is a nerve which is going to supply the tongue. Kaun hoga ye? Kaun hoga ye? The nerve which is going to supply the tongue. And this is what we call as the hypoglossal nerve. The hypoglossal nerve is going to supply the tongue. Hypoglossal nerve. This is C1, C2 and C3. These are the C1, C2, C3 ke roots. These are the roots, ventral rami of C1, C2, C3. I'll start, students, just understand this, do not write anything. Ye important hai, and this is very important and difficult. Like, I'll start. Now, the fibers of C1, bacho, the fibers of C1, they go with the hypoglossal nerve. Yep. The fibers of C1, they descend with the hypoglossal nerve for a short distance. Ek thoda sa distance jate hain. After a short distance, they leave the nerve. They leave the nerve as one. That's the meningeal branch. Meningeal branch of hypoglossal nerve. Meningeal branch. Second, meningeal branch of C1. I'm so sorry. Meningeal branch of C1, not hypoglossal nerve. This is the meningeal branch of C1. C1. Fibers of C1, they go with the hypoglossal nerve. After a short distance, they leave the nerve as one, the meningeal branch of C1. Second is nerve 2. Thyrohyoid and geniohyoid. Nerve to thyrohyoid and geniohyoid. So students, tell me, this thyrohyoid and geniohyoid will be supplied by what? Thyrohyoid and geniohyoid will be supplied by C1. It will be supplied by C1, right? Thyrohyoid and geniohyoid will be supplied by C1. C1, just remember that. It will be supplied by C1. So, fibers of C1, they go with the hypoglossal nerve. After a short distance, they leave the nerve as one, the meningeal branch of C1. Second is nerve to thyrohyoid and geniohyoid. And the third branch is descending down from the hypoglossal nerve. It is descending down from the hypoglossal nerve, but we call this as the descending hypoglossi. Descending hypoglossi. Or this is what we call as the superior root of Ansa cervicalis. The superior root of Ansa cervicalis. So the third branch is descending down from the hypoglossal nerve, and this is what we call as the descending hypoglossi, or we call this as the superior root of Ansa cervicalis. Okay? Now C2 and C3 will join to form a nerve here. C2, C3 se ek nerve banega, and this nerve will descend down. Now this is descending down from the cervical part of the spinal cord. We call this as the descending cervicalis, or this is what we call as the inferior root of Ansa cervicalis. Inferior root of Ansa cervicalis. Now this inferior root joins with the superior root, and this is what we call as the Ansa. Right? So that is how the Ansa cervicalis is formed. C2, C3 se ek nerve aati hai, and this nerve is descending down from the spinal cord. So we call this as the descending cervicalis. Descending cervicalis, or this is what we call as the inferior root of Ansa cervicalis. C1 se jo fibers aate hai, that becomes the superior root of Ansa cervicalis. Okay. Now this joins to form the Ansa. And what are the branches from the Ansa? What are the branches from the Ansa cervicalis? This is nerve to sternohyoid, sternothyroid, inferior belly, and superior belly of omohyoid. The nerve to sternohyoid, the nerve to sternothyroid, the inferior belly, and the superior belly of omohyoid. So these are the muscles which are supplied by Ansa cervicalis. ये सब strap muscles होते हैं ना, strap muscles यहाँ पे. These are all strap muscles, or these are known as the infrahyoid muscles. Infrahyoid muscles. So which strap muscle is not supplied by ansa cervicalis? Anyone? Which strap muscle is not supplied by ansa? Yes, Nirupam. Which is that strap muscle not supplied by ansa cervicalis? स्ट्रैप मसल्स कौन से होते हैं? स्टर्नोहायोइड, sternothyroid, thyrohyoid and omohyoid. These are the four muscles in the muscular triangle. These are the strap muscles. Out of this four, which muscle is not supplied by ansa cervicalis? That's thyrohyoid. Remember, thyrohyoid is supplied by what? C1. Fibers from C1 supplies the thyrohyoid. Clear? Perfect, students. Which other muscle is supplied by C1? Geniohyoid. Geniohyoid. Okay. And this ansa cervicalis lies where? It lies on the anterior wall of carotid sheath. Anterior wall of carotid sheath. Okay, that's it. So this is the ansa cervicalis. Okay, we'll start with the last MCQ here now. Answer this. Answer this, bachcho. Answer this. A 40 years male comes to the clinic with decreased taste sensations. Decreased taste sensation. The moment taste sensations comes to your mind, tell me, anterior 2/3 of the tongue. Anterior 2/3 of the tongue. Who supplies taste sensations? Anterior 2/3. Anterior 2/3 of the tongue, the taste sensations supplied by chorda tympani. Chorda tympani, that's a branch of facial nerve. That's a branch of facial nerve, right? Posterior 1/3 of the tongue, who supplies? Glossopharyngeal nerve. And the posterior most part of the tongue, who supplies taste sensations? That's the internal laryngeal nerve. Internal laryngeal nerve, that's a branch of vagus. That's a branch of vagus. The internal laryngeal nerve, that's a branch of vagus. Okay. So answer is C for this. Very good. Answer is C for this, right? So students, can you tell me there's a common nucleus for these three nerves, 7, 9 and 10th nerve? There's a common nucleus for the 7th nerve, the 9th nerve and the 10th nerve, which carries special sensations from the tongue, and that's the nucleus of tractus solitarius. Nucleus of tractus solitarius, right? So a 40 years old male comes to the clinic with decreased taste sensations. Right, sensations were not felt in the anterior part of the tongue. So we are 100% sure who's involved. Chorda tympani, that's facial. Chorda tympani, which is a branch of facial, is involved. Lesion of facial nerve is suspected. Very good. One of the following statements about this nerve is false. Supplies the stapedius muscle. Kya bolte ho? Yes, yes. Facial nerve is a nerve which pharyngeal arch. Second. And all the muscles which are derived from the second pharyngeal arch are therefore supplied by facial nerve. Which are these muscles? These are the muscles of facial expressions. Second, the muscle in the ear, that's the stapedius. Two more muscles, the stylohyoid and the posterior belly of digastric. Stylohyoid and the posterior belly of digastric. So these are the muscles derived from the second pharyngeal arch. The muscles of facial expressions, the stapedius, the stylohyoid and the posterior belly of digastric. Attached to the brainstem at the pontomedullary junction. Students, what do you say? Correct hai? Yes, the facial nerve is attached to the brainstem at the pontomedullary junction. Correct. There are three nerves attached to the pontomedullary junction, the 6th, the 7th and the 8th nerve. So yes, the facial nerve is attached at the pontomedullary junction. Correct. Enters the internal acoustic meatus. Correct. Yes, it enters the internal acoustic meatus along with the 8th nerve and the labyrinthine artery. Enters the internal acoustic meatus along with the 8th nerve and the labyrinthine artery. 8th nerve and labyrinthine artery. Okay. Contains no general visceral efferent fibers. क्या बोलते हो बच्चों? What is this general visceral efferent fibers supply? Anyone? What is this general visceral efferent fibers supply? You can answer this. What do the general visceral efferent fibers supply? Chalo, bolo, answer students. What do they supply? General visceral efferent fibers, they supply the glands. They supply the glands. The general visceral efferent fiber supplies the glands. And remember, all the glands in the head and neck are supplied by facial nerve. Except parotid, which is supplied by glossopharyngeal nerve. So contains no general visceral efferent fibers is wrong. It does contain the general visceral efferent fibers, and this general visceral efferent fibers are going to supply all the glands except parotid. They supply all the glands except parotid. All the glands का मतलब क्या है? Lacrimal, nasal, palatine, pharyngeal, submandibular and sublingual glands. Okay, lacrimal, nasal, palatine, pharyngeal, submandibular and sublingual. So all the glands in the head and neck are supplied by facial nerve except parotid, which is supplied by glossopharyngeal nerve. And what is the component required to supply the glands? General visceral efferent component and the general visceral efferent fibers. And if you can tell me what is the name of the nucleus of the facial nerve to supply this glands? What is the name of the nucleus of the facial nerve to supply the glands? Anyone? What is the name of the nucleus of the facial nerve to supply the glands? That's the superior salivatory nucleus. Superior salivatory nucleus and the lacrimatory nucleus, they supply the glands. What is the name of the nucleus of the facial nerve which supply the muscles of the second arch? Muscles of the second arch are supplied by motor nucleus of facial nerve. Motor nucleus of facial nerve. What else? The facial nerve supplies the tongue. And what is the name of the nucleus of facial nerve to supply the tongue? This is the nucleus of tractus solitarius. And the facial nerve also supplies the external ear. It supplies the external ear. And what is the name of the nucleus? It gives all the sensations to the spinal nucleus of the trigeminal nerve. So these are the nucleus of facial nerve. Okay, the superior salivatory and the lacrimatory nucleus which supplies the glands. The motor nucleus of facial nerve which supplies the muscles of second arch. The nucleus of tractus solitarius which is going to supply the tongue. And the spinal nucleus of the trigeminal nerve which supplies the external ear. What is this component which is going to supply the glands? That's a special visible efferent component to supply the glands. What is this? Okay, sorry. This would be the special visceral efferent. This would be the general visceral efferent component. This will be the special visceral afferent, and this will be the general somatic afferent component. Clear as students? Any doubts in this? You can ask me. कोई doubt है तो पूछो. If you can tell me which are the two ganglions related to the facial nerve. Which are the two parasympathetic ganglions related to the facial nerve. One is the pterygopalatine ganglion and the other one is the submandibular ganglion. Pterygopalatine ganglion is also known as the spinopalatine ganglion. Spinopalatine or pterygopalatine ganglion, and दूसरा है submandibular ganglion. These are the two ganglions related to the facial nerve. What does the submandibular ganglion supply? It supplies the submandibular and the sublingual glands. Submandibular and the sublingual glands. What does the pterygopalatine ganglion supply? Lacrimal, nasal, palatine and pharyngeal glands. Lacrimal, nasal, palatine and pharyngeal glands. Okay, That's about the facial nerve. Okay, students, just to brief you about our platform, what all new courses are going on. I'll just brief you about our platform. Just have a look here. So students, we've got this plus subscription in which there is access to daily access to live and recorded classes, learning from the top educators, live quizzes and tests going on, study on the device of your choice. And now students, you can access to our question bank with 25,000 plus MCQs. And an iconic subscription where you get the best of Unacademy and pre-platter. Special class features in which there is interactive live class, an interactive class. Polls for the learners. Okay, the options are given and you can answer the poll. Raise a hand technique in which if you press the icon, you can directly talk to the educator. Never miss a class with proper notifications being given before each classes. Lecture notes. You can get access to the recorded lectures if you miss the live lectures. Anytime, anywhere, you can access the lectures and get your doubts solved. Okay. A highly effective and updated question bank has been prepared with detailed explanatory answers based on the recent MCQ pattern. Some 25,000 plus MCQs specially for you. Raise a hand technique in which if you press the icon, you can directly talk to the educator. These are our toppers, the NEET PG toppers in the recent exam. They've got very good marks and we congratulate to all of them. Yo, students, there's a free grant test for the FMG students. You can pass this message if you have got any FMG friend. Okay, the Foreign Medical Graduate Examination. It's a free test. It's on 13th of November. Yes, 13th of November. It's a free test. Come on, give this exam. Let's crack it. 9 p.m. Now, we have already started with these two batches from yesterday. We have started with the Focus FMG High Yield Revision batch. It's a very high yield batch. Golden points are given. And Target NEET PG 2022 batch. We've started it from yesterday. And now students, boost your medical preparation. With 24 months, you get 4 months free subscription. With 12 months, you get a 2 months free subscription. And students, now added with 6 months, you get 1 month free subscription. Okay, and you can use any educator code to get an 10% extra benefit. Download the Unacademy app and subscribe to it. Okay. Any doubts if you have till here, you can ask me. Any doubts if you have, you can ask me. Yes, students, any doubts if you have, you can ask me. So I'll be taking such lectures for you. So MCQ based lectures. 3-4 lectures. If you want any specific thing, you can tell me. Students, any specific thing. Bolo bachcho. If you want any specific thing, any specific topic to be discussed, you can let me know. But this is how we'll be accessing the MCQs. Any doubts? The session is open for doubts. I still have got 2 more minutes to go. If you have any doubts, you tell me. Okay, I'll ask you something. Tell me, what is the nerve supply of lumbricals? Can you tell me this? Nerve supply of lumbricals? Nerve supply of lumbricals. Bolo. We've got 4 lumbricals, 2 lateral, 2 medial. The lateral 2 lumbricals are supplied by whom? The lateral 2 lumbricals are supplied by medial nerve. The medial 2 lumbricals are supplied by the ulnar nerve. The lumbricals of the hand I'm talking about. The lateral 2 are supplied by the medial nerve and the medial 2 lumbricals are supplied by ulnar nerve. And what is the action of lumbricals? The lumbricals will cause flexion at the metacarpophalangeal joints and extension at interphalangeal joints. That's the action of lumbricals. Flexion at MP joints and extension at the interphalangeal joints. The lateral 2 are supplied by medial nerve and the medial 2 lumbricals are supplied by ulnar nerve. And if these lumbricals are paralyzed, if the ulnar nerve is paralyzed, suppose if the ulnar nerve is paralyzed, the 3rd and the 4th lumbricals are gone, we get claw hand of the last 2 digits. If the median nerve is injured, you get a claw hand of the index and the middle finger. So this is what we call as a partial claw hand. Partial claw hand in median nerve and ulnar nerve injuries. But suppose if both median and ulnar nerve are involved simultaneously, if both median and ulnar nerve are involved, we get a complete claw hand. When do we get this? When do you get a complete involvement of median and ulnar nerve? Which is the root which supplies this intrinsic muscles of the hand? Which is that nerve root which supplies the intrinsic muscles of the hand? That's the T1 root, T1. And this T1 root is mainly present in two nerves, the median and ulnar nerves. An injury to this T1 root, injury to this median and ulnar nerve leads to a complete claw hand. And when do we get this? In Klumpke's paralysis. Klumpke's paralysis. Klumpke's paralysis is injury to the lower trunk of the brachial plexus. Yes, the nerve roots involved, C8 and T1, and then you get this claw hand. Okay, just a filler. I had some time, so I just filled this gap here. Thank you, my dear children. Thank you to all of you. God bless you and all the best. I'll stop here. Meet you soon once again with